I think now we'll move on to our next speaker, who is Angela Ching, and she's going to talk about a randomised controlled trial of job retention vocational rehabilitation for employed people with inflammatory arthritis, the WORKWELL trial.
Hi, good morning everyone. Thanks for that, Loz. So I'll be briefly talking about this WORKWELL trial. This trial is sponsored by the University of Salford. It's funded by a charity called Versus Arthritis, and the chief investigator is Professor Alison Hammond here at Salford. I'm the trial manager for the trial, and we also have collaborators over at the University of Manchester, Lancashire Clinical Trials Unit team, and also the Patient and Public Involvement Group. So just as a brief background, inflammatory arthritis is a term used to describe a group of conditions which causes effects on your immune system. So it causes patients to experience pain, stiffness, and joint damage. So the most common forms of inflammatory arthritis are rheumatoid and psoriatic, and these conditions can affect your whole body and can happen at any age. So the most common work problems experienced by patients because they have pain, fatigue and physical limitations, and these can lead to a whole host of problems such as poor work balance, the loss of job confidence. Some people may be unwilling to disclose their condition at work, and they may be reluctant to speak to their employers to modify their jobs. This is probably due to fear of how their employers may treat them, and this can then lead to unadapted work tasks and unadapted equipment and work environment, which makes it harder for people with arthritis to work and to stay in their jobs. So the impact of rheumatoid arthritis on work is quite large. 2/3 of people with rheumatoid arthritis have reported work impairment, even if they have a low disease activity level. Up to 40% stop working within 5 years of diagnosis. And the overall cost to the UK economy due to productivity losses is almost 8 billion a year. And many employees feel that they do not get the support from their employers, but also employers have a lack of awareness of how to support their employees who have long-term health conditions. So the aim of the WORKWELL trial is to answer these 4 questions. Do employed people with inflammatory arthritis receiving the WORKWELL intervention have fewer work problems and less risk of job loss compared to those receiving written information? Do they have better health compared to those receiving written information? Is WORKWELL cost effective? And what do people who receive the WORKWELL information think of it? I'm just going to talk you through a brief trial outline. The participation period is 12 months. We're recruiting employed adults with rheumatoid arthritis, inflammatory arthritis, or psoriatic arthritis. And when they agree to take part in the study, they complete a baseline questionnaire. Once they return that, they get randomised, and our overall target for this is 240 people. And we're recruiting across 18 NHS sites in the UK. So half of the people randomised will be allocated the intervention arm, which is the vocational rehabilitation from a WORKWELL trained therapist, and they'll receive an advice pack. And the other half will be allocated the control arm, which is just to receive the advice pack. 6 months after randomisation, they'll be asked to complete a follow-up questionnaire, and then finally at 12 months, they'll complete a final questionnaire, and a small proportion of people will be invited to take part in an interview study to explore what their experiences of being in the trial was like. So just to give you some information about this advice pack, it's a written information pack, and it consists of these 4 booklets. And these booklets have information on working with arthritis. It also provides work-related solutions that participants can try out in their workplace and where to seek support from. We've also included the Equality Act, which will give participants some information about their rights at work. And then those who are receiving the intervention arm will have an average of 4.5 hours of contact time with the WORKWELL trained occupational therapist over a 2 to 4 month period. So at their first appointment with the therapist, they'll work together and they'll complete a work experience survey, and this will help identify the work barriers that participants are experiencing, and then they can prioritise the work activity limitations that the participant can work on over the 2 to 4 month period. And then the OT will then formulate some individualised solutions for the participants. And this could range from modifying their workstations, advice on stress management, or even support and providing confidence for the participants to go and speak to their employers about job modifications. Participants will also complete goals and action plans, and this is reviewed at each appointment. So COVID is a pretty hot topic at the moment, so I'll just spend a few minutes to talk about that. It's actually had quite a big impact on the trial for various reasons, which I'll go through. So pre-lockdown, we'd managed to randomise 162 participants out of our 240 target, and we were actually on course to finish recruitment in time, which was the summer, this summer. But the trial was paused back in March, and all of our sites had to pause as well because the trust just didn't have the capacity to actually do non-COVID related studies. So at trial pause, we needed to contact all of our participants to let them know that the trial had paused, and the ones especially who were midway through their treatment or not yet started treatment, we just needed to let them know what's happening. We had loads of meetings around contingency planning and also how to actually restart the trial when it was possible. So this period really tested our creativity and teamwork skills, really. And one of the main amendments we did was actually the intervention delivery methods, because OTs were seeing patients in clinic and providing their treatment that way. So we have added the options of providing telephone and video consultations as well, because most of the appointments were then moving to remote contact. We actually managed to reopen our first site at the end of July. But then with reopening, we also needed to retrain our site staff as well, because we'd put in place new methods of consenting and also different methods of recruiting participants. And the OTs at the sites also were trained on how to use these video consultation softwares, because not many of them had come across that before. So the trust needed to train the therapists. And when we reopened, we knew that we'd have fewer potential participants to be able to approach for recruitment because of various reasons. So the demographic of our trial is to recruit employed people with arthritis. So people were furloughed, and unfortunately some had lost their jobs, and also some were shielding, so they were not able to work from home. So we couldn't really recruit those people, and we had to delay them. And then what we've done to try and increase that kind of recruitment rate is actually we've had to tap into our in-house kind of arthritis volunteer database and contact participants that way and see if they'd like to take part in the trial. What we've also had to do is to do mail shots. So sites were able to identify people in their databases who are employed and also have arthritis. So we send them an information pack and then we follow up with a phone call. And also to make things interesting, OTs were redeployed as well during lockdown and the trial pause. So they were working in different departments and different hospitals. So they were not able to actually continue to treat our patients. So luckily we have 2 WORKWELL trained occupational therapists here at Salford. So the chief investigator, Professor Hammond, and also Dr. Yellis Pryor, who've really been able to step in recently. So they've been able to resume treatment for these participants and also treat new participants coming in. So currently we've been able to randomise up to 96 participants now since we've restarted back in July. We still have a little way to go. We'll be recruiting up until the end of January, and hopefully we'll try and get up to the 240 as close as possible to that target. So and that's it. Yeah. Thank you very much for listening.
Thank you, Angela, and I think everyone listening to that will just think, well done for managing to keep a work-related study going over the COVID period. Blimey, that's a challenge and a half.
Yeah.
So I've got a couple of questions. Could you explain a bit more about what happens in this? What do the OTs actually do during this 4.5 hour intervention that the intervention arm patients get?
Yeah. So when they are completing the work experience survey, we call that a work assessment. So it's quite a thorough booklet that the therapist goes through with the participants. So it splits up into loads of different kind of work difficulties and work problems, kind of areas that they can speak to the participants about to identify what sort of work problems they might be experiencing. So that usually takes about an hour to an hour and a half of the OT's time. And then they find solutions and set the goals for them. So the next few appointments will be about informing the participants of what the solutions might be, and then giving them about a month to try that out at their workplace. So people who may have identified, for example, 3 work problems to work on may actually take up the full 4 appointments, for example. But then some people who've only got a couple of things to work on, they may have less appointments. So it's to review the goals and then their action plans, and to provide support for the participants.
Okay, thanks. And do they then, is the communication only with the employee? There's no communication between the OT and the employer to support any changes that might be needed? So
there may be. So it depends on what the kind of issues identified are. So we are, the OTs are able to go on site visits if the employer consent to that and the employee is happy for that to happen. So we have had some OTs go and look at people's workstations or how they work, spend a few hours with them perhaps and just observe, and then they can speak to their employers if needs be. But I think the part of the programme is actually to try and provide the participants with support and the confidence so they can speak to their employers themselves as well, to request these work modifications. Okay, thanks. So I think at this point it's time for me to hand back to Jennifer, who's going to introduce our next speaker.